I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Larry Lage.
From the Associated Press, this is Ground Game, Inside the Outbreak. I'm Larry Lage. Today is May 20th. People are discovering that the return to normal is anything but, as nations around the world loosen coronavirus restrictions. Schools, offices, public transport, bars, and restaurants are now on the front lines of post-lockdown life. What a return to normal looks like varies widely, from migrant workers in India finally able to catch trains back to their home villages, to wealthy shoppers returning to boutiques on Rodeo Drive in Beverly Hills. In Italy, once packed restaurants and cafes are facing a huge financial hit as they reopen with strict social distancing rules. We're joined by Anna Johnson, AP's news director in Europe and Africa. She's based in London. She's also worked for the AP in the Middle East and also in Phoenix. And after listening to her on a lot of 9:15 a.m. global calls, that would be 9:15 in the East, I'm so excited to have you on with us today.
Thank you so much, Larry. I'm happy to be here.
Tell us a little bit about what life is like for you professionally and personally in London.
Sure. So we'll start with professionally. I've been working from home since mid-March, and that's been going okay. I live within walking distance to our main office in London, so I can sometimes I walk by it and I see it, but I haven't been inside in quite a long time. I think, London it's been an interesting place to be here. I'm from Chicago originally, and to live, far away from home during all of this. When I look outside and I'm around my neighborhood, there's lots of people out and about. The traffic has picked up. It's been really gorgeous. So the parks in London, which are just fabulous, have been, really full with people and everyone trying to, go for a cycle or to go running or to just, kind of walk around and get fresh air. And that's been truly, truly great. I took a walk to central London for the first time in a really long time. And it was interesting because as I started out in my neighborhood and in the neighborhoods around me, it's very residential. So you have, more people out and about. But as I walked closer and closer to central London and then was in central London, through Soho and Chinatown and into Parliament, it just became like more and more vacant. And you could really tell a difference where a lot of people don't live. And it's less residential. It is still quite vacant and, restaurants boarded up and closed, no stores open. It's still, very much in a lockdown mode. So, we're still in London. There's few, you can play tennis, you can play golf, you can go outside as much as you like. And some people have returned to work, but it's still very much, in kind of a lockdown stay at home mode, and really will be for, a while to come. The pubs, the restaurants, those types of things, we don't expect them to open until sometime this summer, maybe.
On my last visit to London, we actually, with some colleagues from the AP, went to some pubs in Camden. Is the office still in that neighborhood?
It is. Yes, it is in Camden. It's normally packed full. If you've ever been to the Camden market, it's just packed full of people all the time, like every day of the week, and particularly on weekends. And as you get closer to summer, there's just more and more tourists in London, and it's a really popular tourist destination. And I did a run, and it's not too far from my house, as I mentioned. And so I did a run through there, and it's eerie. It really is. It's just so empty. Everything's closed. All the vendors are closed, and it just has a completely different feeling. And, you wonder a place like that, a market that's really well known, and there's lots of them in London. But, it's really where, there's usually lots of people, and that's part of it. There's lots of vendors, small shops, little, food carts. And, the idea of those sort of reopening, returning anything to like, I guess, quote unquote, new normal seems really far away.
One of the reasons we wanted to have you on is to give us a global view of this pandemic outside of the U.S. Perhaps your look at how the entire world is dealing with some of the same challenges, just at different stages.
Yeah, it's there are so many similarities between the U.S. and the rest of the world with the virus. but there's also differences as well. And, one thing that has struck me from just every person and just us at the AP and just journalists is, we've never had anything like this where we're all really, it's one global story. We're all, dealing with this all at the same time and in different ways and in similar ways, and having, it's such a strange situation, and in some ways has kind of brought people together in some ways, and also I think in many ways has highlighted a lot of the divisions even more so. I'd say right now there's, on one hand, you have sort of this, I kind of used it already, but this new normal happening as countries are reopening. So you have, restaurants reopening, but they have partitions and you can only have, 5 people in there. And you also have, schools starting to reopen. South Korea opened schools and, they have temperature checks on the way in for students. You have to wear masks. And, sort of how people everywhere are struggling with this in so many ways. And there's a lot of angst and anxiety, even in places that have, social safety nets and the government help, that, this just way of life and from an economic perspective is not very sustainable. And we're seeing that kind of grow everywhere. And then though, on the other side, and these are in a lot of countries where, not all of them, but in many of them where the rate of infections and certainly the number of deaths, the rate of deaths is on the decline. But you have other countries where the opposite is happening and the virus is really just starting to, or is in the kind of midst of taking hold in sort of what would be, kind of a first wave, where the number of cases every day are still growing a lot, where the deaths are still growing. And these, of course, are only the ones confirmed and reported in places. And that's really different. You have, in Russia right now, in just confirmed cases alone is right behind the US. And the numbers are just growing. They're doing a lot of testing there, but, the numbers are growing. India is surging past, I think they have passed, 100,000 cases, and the deaths starting to increase. And then, of course, there's Latin America, where really, it is just sort of in the thrust of things. Brazil had its most highest number of deaths in one day, with like over 1,000 in one day that were reported, like 90% of the beds filled in Chile, 80% in Peru. People are dying because they don't have ventilators. They can't get to hospitals. What's so eerie about it is that the situation that we're seeing in a lot of countries there just is really similar to what we saw in Northern Italy and in Spain back in March and April. And in fact, we had our team in Ecuador had talked to a doctor there who made that similar thing, that they feel it. They're seeing it's like been repeated, a month and a half, 2 months later, that people are dying because they can't get ventilators. They can't get to a hospital. They're overcrowded and they just don't have the supplies that they need. So it really is sort of a 2-track thing. And I think we try really hard to make sure that we emphasize that a lot and to show that where you live and the situation and the circumstances of where you live, it can be a really similar, but a very different experience.
I spoke to a friend in South Africa today, and she reports they have eased restrictions there somewhat after being on a total lockdown. They're allowed to be outside to exercise from 6 to 9 a.m. And Africa obviously means a lot of things to a lot of people. South Africa to Egypt, totally different. East and West, totally different. Share with us some of the unique struggles and perhaps advantages that continent has related to supplies and healthcare.
Yeah, it's interesting, Larry, that you mentioned the lockdown in South Africa. It's been among some of the most strict. And I think still, you're saying, that people can now kind of go out between 6 to 9. That alone, it was not long ago that you weren't allowed outside at all for anything. And I think in a lot of cases, this is strict lockdowns were put into place because, it's one of the only sort of, defenses that, might be able to work in trying to slow the growth of the virus. South Africa has the highest number of cases, which is not, terribly surprising in Africa, but we're starting to see an increase in particularly a kind of worrisome increase in the Cape Town area. One of the hardest things for a lot of countries in Africa is it's a couple of things. And I think one of the biggest things is that doctors and medics and others, ones that might be overseas, might be living elsewhere, who would normally come to try to help, they're unable to. That's partly because they're working in the countries where they're living right now, but also because there's such strict travel restrictions and people cannot come and go, and they can't, if you wanted to go help somewhere, you can't. You can't, go and help in another country. You can't move around easily. Many countries in Africa have really strict border controls in allowing anyone in and out of the country. There's also, a lot of concerns about the scramble for supplies, which has been, of course, a global story throughout this entire thing. We've seen this everywhere around the world as countries have been scrambling to get the masks, the gloves, the testing supplies and equipment that you need. But countries in Africa have been at an even greater disadvantage. everyone is competing for that same finite amount of supplies everywhere. We've seen some countries in Africa sort of band together and try to, pool their resources to get the kind of supplies that they need, and trying to make their own supplies, make their own ventilators, that type of thing. And now you're starting to see more donations coming in. There's been lots of donations from China. The US sent, I think, about 1,000 or so ventilators to South Africa last week. But the other thing, too, that's been a real challenge in Africa and in other countries is that because of the travel restrictions and the lockdowns and fears over the virus and getting sick, it has put a setback in the fighting of other diseases, including HIV and TB, where people have not been getting the medicine that they need, have not been getting the diagnosis that they necessarily need. And there's a lot of concern from health experts globally that with TB, for example, that the setback could be more than 5 years because of the virus, because of the lockdowns and the travel restrictions. This is also, immunization efforts, they've been suspended in a lot of places, including ones that were really critical for fighting polio. And so that's kind of becoming an increasing worry among health experts, among governments, among people, that a lot of progress that was made on that, there's going to be a significant backtracking on it. And to get back up to speed is going to be even more difficult going forward. But on the other hand, one of the interesting things is that in a lot of countries, in this particularly South Africa, they've had a lot of experience fighting TB, fighting HIV. Because of that, they have a network of mobile testing facilities and labs, infrastructure around that, and people that know how to do that. So they've been able to kind of quickly jumpstart on the testing and on the tracing, where we're seeing a lot of other countries in Europe and in the US and states in the US where they don't normally do that and they don't have that kind of infrastructure in place, that they're really struggling to figure it out, to recruit the right people, to get sort of that testing centers, the contact tracing up and running. And whereas, there's countries in Africa and elsewhere in the world and already had a very, a good network in place that they've been able to build upon.
If any place could be described as socially distant, it would be New Zealand. Give us an update there, where last month they were talking about just flat out eliminating the virus and defeating this in ways that we didn't hear from leadership in other countries.
Yeah, New Zealand's a really interesting case. I mean, as you know, right, you can easily social distance there. It's an island country and there's 5 million people. So, it's hard to compare New Zealand to a country like India or, even to Italy or to, Spain. It's so different. It's so much smaller. It's more isolated to begin with. But it is really interesting. They took some really, strong measures to start out with. They shut their borders really early. They had a strict lockdown. And were able to quickly kind of, hone in on the cases that they had there, to the point they had several days where there's been 0 new cases. And I do think, they're very cautious, cautiously optimistic, but there is talk about the fact that they might be able to eliminate the virus. Now, I'll know, it doesn't mean though it's sort of like everything is sort of back to normal. There's lots of social distancing happening there. And one of the industries really hurt in New Zealand, and of course, globally, is tourism. Because, it's really hard if you have people coming in and out. That's how the virus can spread quite easily. They've had a really strict lockdown on their borders, and the tourism industry has been one of those places, as we've seen in other countries, that has really, been suffering as a result of that.
Thank you so much for joining us. Please stay safe and stay well.
All right. Thank you so much, Larry.
At apnews.com, today's One Good Thing is about a professional comedian who's a former Tonight Show writer, leading participants through monologue bits and rapid-fire prompts to elicit the students' best lines.
To get started with the comedy class, it was an opportunity to join something while in, isolation.
They're returning to find humor despite the dark facts of the coronavirus. You can read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com.
From the Westwood One Podcast Network.